Do young people get disc pain and degenerative disc disease? It's a great question, and it's a bit of a two-part question. So the first part is absolutely young people. In fact, disc pain is the most common cause of chronic lower back pain. Chronic being anything longer than 3 months in younger people. Well, actually, in all ages, but especially in younger people, it is by far the most common cause of chronic lower back pain. Now, when we talk about disc pain in young people or disc pain just generally, we're not exactly talking about degenerative disc disease. It's a little bit nuanced. We're talking about a tear, an annular tear, which is part of degenerative disc disease on the inside of the disc. So what causes disc pain is when there's a tear that extends from the inside of the disc, where there are inflammatory proteins, to the outside of the disc, to the outer third of the annulus fibrosus specifically, where there are nerve fibers. And then what happens is those inflammatory proteins start to ooze out and they irritate those nerve fibers, and that's what causes disc pain. And then things that tend to put more pressure on the disc, like sitting, bending forward, those things tend to exacerbate that kind of pain. Degenerative disc is sort of sometimes used synonymously, but what it really is as the disc starts to lose the fluid inside of the disc and it kind of gets pancaked. It gets what we would call degenerative. You can have a tear. A tear is sort of part of that process, but you could have a tear in a disc that otherwise doesn't look degenerated. And you could have a disc that's very dried out, very degenerative, that's not necessarily causing pain. But even in young people, even in young people like late teenage, 20s, certainly 30s, you're going to start to get some wear and tear in the disc. It's not that uncommon to start to see signs of degenerative disc, and it's certainly not uncommon in somebody with chronic back pain to have an annular tear, young or old, frankly.